coming in today, Talar. Look, I've got your blood test results here and they're showing me your lipoprotein profile. It's clear from these results that your LDL, triglycerides and total cholesterol levels are really high, while your HDL levels are really low. It's bad news, I'm afraid. Considering you're obese, you're diabetic, you have high salt, fat and alcohol intake, and terrible smoking habits, you're at a really increased risk of cardiovascular disease. Look, I want you to stop eating that. I want you to decrease your salt intake, manage your diabetes with greater care, and start moderate exercise about 3 times a week. You should also increase the amount of omega-3 fatty acids in your diet. I'm going to prescribe you the first-line drug for treating high cholesterol. These are called the statins.
A statin? What's that?
Got just the thing for you here.
Statins are cholesterol-lowering drugs. They aim to reduce the risk of cardiovascular disease. Statins aim to specifically lower LDL cholesterol in the blood that forms plaques and can even increase high-density lipids. Statins stop the rate-limiting step in hepatic cholesterol synthesis. This is done by blocking the binding site of HMG-CoA reductase, which catalyzes the conversion of HMG-CoA to mevalonic acid. They also reduce LDLs from circulation by stimulating low-density lipoprotein receptors on hepatocyte membranes, which increases the rate of cholesterol clearance.
Now the benefits will start immediately, as long as you keep fulfilling your prescription, not like the other 43% of patients who discontinue statin medication within 6 months. Another advantage of statin medication is the potential for increasing your HDL levels by about 10% and decreasing the triglycerides in your blood. Statins also contain nitric oxide, which has numerous positive effects on the blood vessels and arteries, but so do almonds. They also lower the blood levels of C-reactive protein, which decreases the inflammatory processes of the blood vessels.
But like, what are the side effects? Am I going to lose my hair?
Side effects: digestive problems, rashes, hives and itching, increased blood sugar or type 2 diabetes, muscle toxicity, pain and damage, including rhabdomyolysis and joint pain. This will inhibit your ability to exercise. Liver and kidney problems, insomnia, headaches, depression, memory loss or confusion. If you can remember to let us know that you're experiencing memory loss, that would be great for our statistics. Swelling of the face, throat, tongue, lips, eyes, hands, feet and ankles, or lower legs. Extreme fatigue, unusual bleeding or drowsiness, pain in the upper right part of the abdomen, contraindicated in pregnancy and breastfeeding. Alcohol will increase the risk of many of these side effects. Please note that scientific trials providing the benefits of statins are largely funded and coordinated by the drug companies and are not from long-term independent evidence-based observations. But don't worry, they're not biased. 9% of people completely discontinue statins due to unwanted side effects. I'm going to prescribe them anyway. Here you go. See you soon.
Thank you. Have we found the saviour for high cholesterol with statins? Well, in 2010 to 2011, approximately 2.6 million Australians used these drugs. Is this limiting further research in the area? And are we using these drugs too much? Let's take a look. Statin, please.
Sure, please.
Thank you. 1 statin, please.
Sure,
Thank you.
All right, 2 for me, please. Thank you very much.
Well, they're definitely not overprescribed. Anyway, there are currently 5 statins on the market. These include the synthetic statins, such as rosuvastatin, atorvastatin, and fluvastatin, and also the fermentation-derived natural statins, such as pravastatin and simvastatin. Type 2 synthetic statins are known to form more interactions with HMG-CoA reductase, which is desirable. Nonetheless, both types vary significantly with their effects and side effects, rendering neither the new versus old more beneficial. Statins are the most prescribed drug in Australia, but do they encourage people to eat the wrong foods? Let's ask Dr. Smith.
Well, Hayley, a 2007 study found that patients would rather take pills than go on a diet. Lifestyle changes should be the first-line treatment, and patients need to understand that statins are not a magic bullet.
Could we all benefit from taking statins?
A wide range of patients can benefit from statins, including teens and children with genetic predispositions for high cholesterol and people over 50. If a patient can withstand the dramatic side effects of statins, then they are beneficial.
Well, that's it for Statin Wars. Thanks for watching.